Ptosis is a droopy eyelid that's slightly different to dermatochalasis. Now, dermatochalasis is what blepharoplasty surgery for, and it's very common to have excess upper eyelid skin. And that medical term, dermatochalasis, is for upper eyelid skin. But ptosis is when the eyelid itself is drooping. And with children, we have to ask ourselves just these key things. First of all, is it congenital or is it acquired? Congenital means that they have been born with a droopy eyelid. And usually, if they haven't had a forceps delivery, that tends to be congenital in that the muscle just hasn't quite fully developed. And as a result, the eyelid is droopy. The second question, if they do have congenital ptosis, is does it block the vision at birth? If it's blocking the pupil at birth, this is seen in the ophthalmic world as a very urgent case and needs to be seen and treated aggressively. The reason being is that if it's blocking the vision at birth, that eye may not develop the visual function properly, and it needs to be treated incredibly soon so that that eye can develop normally like the other eye. The third thing is, does it cause astigmatism? Now, astigmatism, if it does cause astigmatism or by the pressure of the eyelid pushing on that eyeball, that can sometimes cause some blurring of vision. It's not as serious as a complete blockage of the pupil, but it can lead to a lazy eye or that eye or the vision not developing properly. And as a result, it needs to be assessed and monitored. And should that be noticed that the vision isn't developing, we would then go in for surgery early. So the other thing, or the final thing, is does it cause bullying at school? This is more important when they start to go into junior school. Are they being picked on by other children, and is it affecting their confidence because they're looking slightly different to the other children? In this case, we do go in early to try and correct that ptosis. In all other cases, we try and leave it until adulthood, because when they're adults, we can do the surgery under local anesthetic, and it tends to be far more accurate when it's done under a local anesthetic, and the result can be better and longer lasting. If your child has ptosis, consider these things, see if it's urgent. Either way, it needs to be monitored and the vision needs to be assessed throughout, but there are conditions in which surgery needs to be performed early.